I had a couple of old fractures in my back, and one of them broke off. So it caused a herniated disc, which compressed my sciatic nerve. I had no feeling in my left leg other than pins and needles. I kept falling, loss of bladder control, excruciating screaming pain. After going through all the tests and jumping through all the hoops, my neurosurgeon said that I needed surgery right away, and we began that process. And basically, I had a broken back, and I'm like, oh my gosh, that was shocking enough that I'd been walking around on a broken back. But I was flabbergasted when they called me and said, well, HealthNet has denied it. Don't worry, my surgeon said. They do this all the time. He said they do this to everybody. We'll put it through another time. It may take another month or so, but you'll get it. I've never lost one yet, he said. So I said, okay, and I'm trusting. So we go through it again, and I go back in, and he says, I'm sorry, they denied it. And he actually did it a third time. And they cited the Milliman Care guidelines that they follow in determining whether or not a person needed back fusion, which is what I needed. And my doctor pointed out that I met numerous criteria of those very same guidelines, which I don't know who makes those guidelines up, but whatever. And so we put it through another time, and it was denied again. I eventually appealed to HealthNet. They had a ridiculous process where they sent my records to an OBGYN who said I did not need back surgery. And so then we filed another appeal, and they sent that one to a cardiologist who decided also that I did not need back surgery. And I went back to see my surgeon. What do I do? I'm in screaming pain. They recommended, HealthNet said that the appropriate course of treatment for me was physical therapy and pain management. So hence I was on oxycodone, very strong oxycodone. I was unable to walk. I was in severe screaming pain. I had to go get epidurals in my back every 3 months while I was going through this process. My doctor finally said, he was extremely upset to the point where he left the room cursing, and he came back and he said, I'm sorry, Ms. Scott, I'm no longer your doctor. HealthNet is your doctor. They will make all your medical decisions. And so I called HealthNet, and how could you do this? I have a broken back. I'm in screaming pain. I can't work. I can't cook. I can't do anything. And they said, I'm sorry, but this is our policy, and you don't meet the criteria. This is not medically necessary. I said, it's covered. It's back fusion. A lot of people have that. Oh, no. They did agree to go in and fish out the broken bone that was floating in the back, but they would not agree to fixing it. That didn't make any sense to me. This doesn't compute. And so tears, and my employer's wondering, when am I going to come back? I had a career for 20 years with Department of Child Support Services as a supervisor. And I couldn't give them a date where I could return to work. After a year, they said, I'm sorry, but we have to fill your position. I mean, I was a supervisor of the call center. I understood that. I know you have to fill my position. I'm sorry, I'm still fighting this. And they completely understood. But there wasn't anything I can do, so I had 3 choices, and that was to quit, to be terminated, or to retire early and to go on disability. So I had to take that option, which gave me a tremendously reduced pension, and I'm on disability. And so there I sat for a while until seeking. I still can't believe that they could do this. Still can't believe it. And so I sought legal assistance, and after the suit was filed, within a matter of weeks after receiving the lawsuit, HealthNet suddenly granted the surgery. So I went and had the surgery in February. It was like a 2-hour surgery. I spent 3 days in the hospital. The minute I woke up, I knew I was fixed because I didn't have this screaming pain running down my leg. I actually, even through the surgical pain, was able to get up and really walk across the room for the first time without being in pain. Changed my whole life. Unfortunately, during that time, I lost my career, and as a result, I also lost my home. I have 4 grown children and 3 grandchildren. My youngest grandchild is going to be 2 years old, and Basically, for the first year of his life, I wasn't even able to pick him up or hold him. I wasn't able to cook. I wasn't able to drive. I wasn't able to go anywhere, do anything. Why? Why? This was a simple, common surgery. Why? How dare they say that this isn't medically necessary, overruling 5 of my doctors? I decided, even though they granted the surgery, I'm not going to let this stand. In my opinion, and this is what I included in my lawsuit, this was intentional infliction of pain and suffering, and it was also torture, intentionally, on a patient who's in severe pain. They forced me to become addicted to oxycodone, lose my career, and lose my home. For nothing. For what? To save money? I've been paying over $2,000 a month premium for over 10 years. Why? Why am I paying this if they're not going to cover it? I want it to stop. People die from these decisions. I'm fortunate. I wasn't going to die. It just affected my quality of life, which now I'm recovering and is returning. I don't even know what to say other than this practice has got to stop, and I'm here to take this all the way and make sure that this doesn't happen to anybody else.